Today's lesson is about manipulating techniques with fitful needle. The needle manipulation can be divided into 5 steps: holding needle, inserting needle, manipulating needle, returning needle, and withdrawing needle. Let's get to know them one by one. The first step is holding the needle. Generally, in clinical practice, the thumb, index, and middle fingers of the right hand hold the handle of the needle like a posture of holding a pen. So, the right hand is called as puncturing hand. In the process, the left hand presses around the punctured point to fix the skin so that the needle can be inserted into the right spot. Therefore, the left hand is called as pressing hand. The second step is inserting the needle. Insertion of the needle needs to be coordination of 2 hands. The puncturing hand is to hold and manipulate the needle. During the insertion, the tip of the needle is punctured rapidly through the skin of point with a certain finger force. Then the puncturing hand exerts the manipulation of rotating, lifting, and thrusting. The pressing hand is to fix the location or point and support the puncturing hand when inserting the needle vertically and quickly in order to reduce pain caused by needling. Clinically, the common methods of inserting are as follows. The first one, inserting the needle with a single hand. This method is commonly applied for short fitful needles. The second one is inserting the needle with guide tube. Put the needle into a needle tube made of plastic, which is usually 5 mm shorter than the selected needle. Place and press one end of the needle tube against the point by left hand and hit the needle tail quickly by index finger of the right hand. Remove the tube after the needle is inserted into the point. This method is nearly pain-free and suitable for children and people who are afraid of a needle. The last one is inserting the needle with both hands. There are 4 kinds of needle inserting methods with both hands. Thumbnail-assisted insertion. This method is suitable for short needles. Pinch needle insertion. This method is suitable for long needles. Stress skin insertion. This method is suitable for points on areas where the skin is loose, such as points on the abdomen. Pinch skin insertion. This method is suitable for points where the skin and muscles are thin, such as points on the forehead. The third step is manipulating the needle. The basic manipulation techniques contain 2 techniques: lifting and thrusting method, turning and rotating method. These 2 techniques may be applied respectively or combined together. Lifting means to move the needle from the deep level to the superficial level after the needle is inserted into the point, while thrusting is to move the needle from the superficial level to the deep level. During the manipulation, it requires even finger force. General range 0.5 to 1 cm. Frequency about 60 times per minute. Keep the needle straight and maintain the original direction and angle of the needle. Turning and rotating are manipulations that twist the handle of the needle using the thumb and the index and middle fingers forward and backward alternately. During the manipulation, it requires even finger force. General range with 180 degrees, but not rotating clockwise or counterclockwise alone, for it will tie the muscular fibers to cause pain or stuck needle. Why should the fitful needle be lifted and thrusted or twirled and rotated? The only purpose is to make the patient get the qi. Getting qi is a very important concept in acupuncture because getting qi is related to the therapeutic effects of acupuncture. Just like a molecular pivot states, when there is the level of qi, then there is therapeutic effects. So let's learn more about getting qi. Getting qi, known as a level of qi in ancient time and the needling sensation in recent time, means that after the needle is inserted to a certain depth of a point, it is manipulated with the needling techniques of lifting and thrusting or turning and rotating to get the sensation of a meridian qi. How to judge whether the patient has gotten qi? It can be evaluated from two aspects. After a level of qi, the patient will feel soreness, numbness, distension, or heaviness around the point, which may also transmit to other places along the course of the meridian. Some patients show the reactions of muscle pulsation, tremorings or tidal belt, red or pale line along the meridian. Meanwhile, the manipulator will feel tightness around the needle or needle trembling. After the level of qi, what the patient needs to do is to lie on the bed and return the needles. In general, returning the needle for 15 to 30 minutes is advisable for most common diseases. The duration of the needle retention should be prolonged in chronic, intractable, painful, and spastic diseases. The last step for acupuncture treatment is to withdraw the needle. When withdrawing the needle, press the skin around the needle with the thumb and index finger of the pressing hand. Rotate the needle gently and lift it up slowly to the skin level. Then withdraw it quickly and press the puncture point with a sterilized cotton ball for a while to prevent bleeding. That's all for today. Thanks for watching.